I was rounding the corner and a kid was standing where he wasn't supposed to be. And I didn't have time to move or anything because you're going really fast. And I ran into him and hit both sides of my head on the ice.
For Abby Miles, a young skater who loves speed, recovery from that concussion seemed to move in slow motion. A month later, a car accident brought her progress to a screeching halt.
Right before the car accident, I was finally starting to get better again. My headaches were going down. I started doing better in school again. Everything was looking up for me. And then we got in that accident.
There was definitely a night and day difference between what Abby had been like and what she was after the accidents. She was usually more of a happy, easy to get along with girl, and she just kind of became more and more irritable and crabby and just more withdrawn, and that was not her.
She was a 10th grader suddenly functioning at a 6th grade level, having trouble with word recall and finding studying nearly impossible. All symptoms of brain injury.
One of the things that we struggle with here is, people want to know, what's my recovery going to look like? We don't know. They're all individual.
David King of the Minnesota Brain Injury Alliance helps families coping with concussions. While awareness is growing, he says parents don't always know what to look for.
Only about 10% of concussions result in a loss of consciousness. Back when parents of today's athletes, when they were growing up, that was really one of the major signs that we looked for. If there was a loss of consciousness, then we have a concussion. And we know that that's not true.
Afterwards, they may be dazed or confused. They may have blurred vision. They may have sensitivity to light, sensitivity to sound, ringing in their ears, difficulty remembering things or concentrating, difficulty sleeping. That can all occur after a concussion.
We asked CDI's Dr. Blake Johnson what you can expect if your child gets a sports-related concussion. The first test is likely a CT scan, also known as a CAT scan. This helps doctors look for signs of acute bleeding or swelling. Later, your child might get an MR scan. Here, doctors are looking for injury to the brain tissue, like a bruise or tiny signs of bleeding. It's all part of the concussion protocol at CDI.
We have a dedicated post-traumatic brain imaging protocol, which includes routine brain imaging, but also adds some additional sequences which increase the sensitivity for detecting microhemorrhage, which may be left in the wake of a head injury.
This is her book with all her different doctor notes.
Abby saw so many doctors and had so many tests. Her mom started this binder, trying to keep track of all the reports, notes, physical therapy, and treatments. Abby was never cleared to return to sports. While her concussions changed the course of her life, Abby says the hardest part is behind her.
When you have a concussion, you feel really alone, and you think that no one else has the same symptoms as you. You think no one else is going through it, but there's a lot of people out there that are, and there's a lot of support out there to help you.